Hello and welcome to Dental XP. The next patient that we're going to be treating, Greg, is a new patient to the practice. He's a 50-year-old man. He's hypertensive, extremely stressed out, recently lost his job. He presents with a history of sporadic dental care. He has a diagnosis of generalized moderate periodontitis with a significant abscess on tooth number 30 with a periodontal endodontic lesion with probing to the apex of that tooth. The distal root of tooth number 30 is completely housed in soft tissue and inflammation. The tooth has been deemed hopeless due to an endoperiodontal defect. He's coming to see me today for extraction of tooth number 30 with bone grafting and reconstruction of the ridge for the possible anticipation of a dental implant in the future.
This next patient, Greg, has an infected molar, tooth number 30, the lower right first molar, has a periodontal and endodontic defect. His endodontic treatment was performed about 10-15 years ago. Tooth now probes to the apex on the distal buccal aspect. It has some sensitivity, and we're going to be removing it. What we just did was we cut through the porcelain with a diamond burr. Now we're using the H4 carbide burr made by Brasler, which is part of the Sonic Seminars burr kit, and we're cutting through the metal aspect of the crown, and it cuts through very nicely. We use high-speed suction and a saliva ejector at the same time of cutting through the tooth. We'll cut through the buccal first, and then I'll cut through the occlusal aspect, and at this time, if possible, I'll try to remove the crown, and then we'll cut right through the root. Right now I'm taking a small elevator, and I tell patients that they're going to feel a little pressure, and we're elevating off the crown. Notice that all of this is done without any flap elevation. We're doing that because we don't want any debris to get underneath the soft tissue. And I'll remove the crown very gently, and then what we'll be left with at that time is some decayed roots, which you'll see in a second. So the crown is now removed, and now we'll finish cutting right through the tooth. At this point in time, we're going to elevate the papillas just a little bit so that I can see where the furcation is. This will give me better access when I'm cutting through the roots. Because what I want to do is I want to separate both roots and take them out independently. Make the initial cut with a 15C. Now I'm utilizing an Orbian knife to pull back the flap. And you can see the furcation peeking through right underneath the buccal flap. Once I see where the furcation is, I get a better view of the tooth, and then I'll be able to cut through it and just remove any tooth structure over the furcation, because I want to keep as much of the roots as possible. I'll take now the same burr that I was using, or I can use a 557, whatever is more convenient for you. I don't need the heavy-duty burr because we've already cut through the metal, and I'll cut through the rest of the tooth to separate the roots. All multi-rooted teeth are taken out as single-rooted teeth. I never take out a multi-rooted tooth. I separate all multi-rooted teeth and then turn them into single-rooted teeth. This time we have a surgical length 557, and we are cutting right through the root and going right down to the osseous crest to make it a little bit easier. Oftentimes, besides utilizing burrs, we use piezo surgery, which you'll see in a minute, to get down along the PDLs to get better access. We've been using piezo surgery in our practice for about 4 years. I'd say about 50 to 60% of the teeth that we take out we do use with piezo surgery. The roots are now separated, and what I'm going to be doing now is just doing a little bit further degranulation. We'll take the interproximal cold tissues out, both mesial and distal to the tooth. This will allow us a little bit better visualization. What you're seeing now is the workhorse of burrs. It is a Neumeier burr. It's made by Brasler. It's like a finishing burr. It's a 12-fluted carbide burr, and it doesn't cut hard tissue very well, but it cuts soft tissue nicely and it cleans things up. Now we're going in with our piezo surgery, and we'll do this at the highest level, and it will vibrate the periodontal ligament